Our eyebrows in chemotherapy. Let's unpack that today. Eyebrows themselves are not directly important in chemotherapy treatment, but their loss can have a psychological and functional effects. So why do our eyebrows fall out during chemotherapy treatment? Chemotherapy targets rapidly dividing cells, including cancer cells, and healthy cells as well, like our hair follicles. This can lead to hair loss, which is alopecia, in the head, and includes the eyebrows and eyelashes as well. We don't realise how important they are until they're gone, and the psychological impact of our eyebrow loss, which frame our face. They play a key role in our facial expressions, and their loss can affect the self-esteem and emotional well-being of a client. Normally, eyebrows protect our eyes. Believe it or not, they help to keep the sweat and debris off your eyes from the top down, and losing them might cause more irritation and discomfort. In relation to their regrowth concerns, while scalp hair usually regrows fairly smartly after you finish your chemotherapy, your eyelashes come back next, and your eyebrows can come back very differently. So how do you manage eyebrow loss? Well, you can use a trusty pencil. The downside of using a pencil is that we're not symmetrical anyway, and if you're right-handed, the right-handed eyebrow will be perfect, but the left one tends not to be as perfect, so you could have them asymmetrical. You tend to sweat a lot in chemotherapy, and all you have to do is that, and you've wiped off one eyebrow and you're walking around the street having no idea that you're only wearing one brow. You can also use this semi-permanent felt tip pen, which tends to give you lovely hair strokes along the area where your brow loss is gone. And that is ideal for those of you who are not suitable for microblading. Also, for people who are not suitable for microblading, can use these lovely stick-on transfers of eyebrows. You can get them on Amazon, and you put them on like a child would put on, you know, those little sticky things that they had, temporary tattoos. They tend to last for about 3 days or so. Some clients love those, but placing them correctly is the hardest part. And yeah, it's great, but not great if you're not good in doing that sort of thing. Next option is what I do, which is microblading, the most natural form of eyebrow tattoo that there is. So ideally, I love for you to come to have the eyebrow captured before you start your chemotherapy, so that you'll always look like you. So you lose your eyebrows, you lose your eyelashes, you lose your head hair, and if you're wearing a cap, say for example the wig is a bit uncomfortable on you, you want to have your face framed. So this is the tool that I use for eyebrow tattoo. Do not, under any circumstances, use an eyebrow regrowth serum without checking with your oncologist first. Some of them contain the hormone prostaglandins, which could upset your chemotherapy plan. Whilst they work, it may not necessarily be something that your oncologist would be happy with. So don't ever use eyebrow growth serums unless you talk with your oncologist first. All right, I hope that helps. Talk to you soon.